Yes, then these statistics are about 28th February in 2021. So when that period, there were 130 million cases of COVID-19 and there were more than 2.5 million deaths up to this day. But then you can refer this slide, refer this graph also, then you can say something. Then please let me know. You can use your chat box also. How many axes are in this graph? How many axes they have used to create this graph? Then how you read this graph? I'm waiting for your answers. How you read this one? How many axes are there? Okay, then what these figures are saying, these colors are representing these regions. So the yellow color is for the region of the Americas. The somewhat like light green is represent the European region. A blue one is representing African region. This pink one is for the Western Pacific region, and green color is for the Eastern Mediterranean region, and the purple one is for the Southeast Asia region. So these are about the cases of number of cases. So these are representative cases. So around the April one, there are comparatively there are more. There are less cases. Then around December 1st, there are more cases. Then comparative to that, if you consider about the deaths are somewhat higher at very beginning rather than the other periods after that period. But anyway, if you consider about the counts of deaths and counts of cases, the number of cases are in millions, but the number of deaths are in thousands. So even though in this case, if we just see the graph, there are more deaths than the cases, but you compare the number of cases and number of deaths, the scales are somewhat different. So actually, there are no more deaths than the cases. So if we take this amount, it is about 25 lakhs. So from 25 lakhs, there may be 60,000 deaths. So when you read this kind of a graph, you need to consider about how many, then altogether there are 3 axes for this graph. So you need to consider what are the scales around those graph axes, and you need to make a proper comparison. Okay, let's discuss about the overview of COVID-19 pandemic. So I think these all things you know, but as a global case, we need to have an understand about that pandemic well. So because that changed the compositions and the size of the population recently, so we need to consider about that. So the WHO have introduced five stages of this case. The first stage is an unknown virus emerges. So in that period, we don't know about anything about this virus. So that is the very beginning stage of that pandemic. And the stage 2, they mentioned a pandemic unfolded. So during that period, that was an unfolded pandemic. Under the stage 3, the pandemic accelerates. So that was a rapid spread period of virus. So under stage 3, we could see that it is uncontrollable virus. Then under the stage 4, that has came in the multi-phased pandemic. Then there were various kinds, alpha, beta, and omicron. Likewise, there were various surfaces for that virus. So under stage 4, we could see that kind of variations of the pandemic. Under stage 5, medical countermeasures, we could find some medical treatments for that cases. I think you will remember at the very beginning of the pandemic, the patients in Sri Lanka had all the caring. There wasn't any specific medicine for that pandemic, but at the end, we were facilitated with some vaccine. So that was the options to recover that pandemic. Then I am not going to read these all slides because you can read these things leisurely and identify how COVID-19 has affected on the population globally. Then you can get ready to write something about this kind of pandemic for your exams. And there are more pandemics and situations which has affected for the global population rather than COVID-19. So you can find what are those. Then as an example, there were some another pandemics like Ebola, malaria, and SARS. Likewise, there were various things. And there were some territorial situations also, like World War II, like this, like this. Then you can study about those things also, how those has affected on world population. Then the research are so important thing in the academic field. So that's a must to development for the theory and all the things. So in this case also, with respect to COVID-19 also, there are various medical and non-medical research. So as a student who engage with an leading academic institute, you can find how we have followed the COVID-19 in this period. By using our official website, you can find what are the studies we have done in this situation. Anyway, you can read this leisurely. I'm not going to present more about this one because all things are in the slides. Okay, but I'd like to add something in here. Implementation of public health and social measures. Then for what? Then we can identify informations along with these 4 categories. Personal perspective measures. What are the personal perspective measures? You can use the habit of wearing face masks, hand hygiene, and respiratory etiquette. Likewise, you can consider about these things. And social distance measures. You can follow these social distance measures like avoiding crowding, workplace measurements, closures, school measures, closures, quarantine of exposed individual, isolation of sick individual, and contact tracking. Likewise, you can follow these things. And environmental measures, surface and object cleaning, increased ventilations, and travel related measures, travel advisors, travel restrictions, border closed, and entry and exit screening. Likewise, there were so many health and social measures to study about the effect on these things on the controlling of the pandemic. So that is a good point to do a research also. You can study how urban people have followed these things and how rural people have followed these things, and how university students have followed these things, and how school students are following these things. Likewise, you can do a study on these things also. So those are the points we need to address with respect to concurrent topics. And I'm not going to read these all here. You can read this specially. Yeah, that is about, let's say something about the SARS. Yeah, then economic impact of COVID-19 pandemic. Then actually we know that that has already affected on the economic sector, because some people have lost their jobs, and some couldn't continue their manufacturing due to various problems, then lack of inputs and labor cost, and there are so many things. So anyway, there are some examples. More than 4% contraction of GDP in 2020 have been lost, and 88 to 150 million people live in extreme poverty due to this crisis. 9% of global working hours lost in 2020, the equivalent of 225 million full-time jobs. Okay, there are some more references, so you can find how COVID-19 has affected on world population.